Hey guys, it's Scott again with Help, and I want to welcome you to Module 2 training. Hopefully you've been able to download your listening guide, so you got that right next to you. And this training is going to be the general mission trip information. We're going to walk through a lot of information on this. It's about 17, 18, 19 minutes, so hang with us. Hopefully it'll be very informative, and it should answer a lot of the questions that you have. So let's go into the computer, and we'll get started on the whiteboard right now. So before we get started on the actual content, one of the things we always want to make sure that we do in any one of our module trainings, obviously, is to remind you constantly, and you'll see this at the top of your paper, of the mission and the values of Help. So you're constantly aware, that's up front. We try to make it a part of everything that we do. And then, of course, we want to start off in prayer. So let me pray for us before we get started in this module. God, whether this is the first time or the 15th time we've gone through this module, we want to acknowledge that you are the creator of all things, and that you are the one who has invited us uniquely to be a part of what's going on in Nigeria, and we're really grateful for that. So God, over the next few minutes as we go through this vital information around these short-term trips, I pray that you would be glorified through it. Speak to us through it. It's something as simple as this training. In Jesus' name, amen. All right, so let's go down our module list, and I want to make sure that we take you through as much training as we possibly can. So there's a couple of things you'll see on your follow-along guide if you want to follow along with us. And we talk a lot about departure and destination. We haven't put a whole lot there in terms of details because it's frankly very simple. There are a couple of airports that we fly out of in the U.S. One of them is the Dallas-Fort Worth Airport. Another one is the Houston International Airport. A lot of teams fly out of there. A third one is the Savannah Airport. We actually have a large contingency of groups coming out of the lowest part of South Carolina and East Georgia. And then we've had some that fly out of Charlotte. We've had some that fly out of Dulles, out of D.C., and then a variety of others as well. So these are the main hubs that we fly out, but that by no means means that if you're flying from somewhere else, that you certainly can't fly out of your airport and either connect or in terms of connect with people here in the U.S., or what you can do is just make a connection over generally in Frankfurt is where we meet a lot of people. So in terms of departures and destinations, those are the airports we go out of. The airports that we go into, 95% of the airport location that we go into is Abuja, or ABV is the airport code, just so you're aware of that, ABV. The other 5% of the time, let's say, maybe not even that much, we go into Lagos, LOS. Now, Lagos is one of the 10 largest cities in the world, so we kind of like to stay away from that just because there's a lot of busyness in Lagos that we just don't want to get in the middle of. Abuja is a much more manageable city, and the airport's on the outskirts of the city. And so it's a lot easier in terms of getting in and out. Let's talk about cost and documents of the trip. So a couple things for you as it relates to cost. We've got some deadlines in place. The cost of the trip is going to be anywhere from $3,000 US dollars to somewhere around $3,600 US dollars. Now you ask why the influx. Well, if you look at the months of May, say through August, those are the summer months, you're typically going to get around that $3,600 mark. It's a much more expensive travel season, and so you'll see those prices fluctuate. But generally, we've not had anybody go over that $3,600 mark yet. Not to say it couldn't, but just be aware that that's generally a range. And by the way, the trips are non-refundable due to Help having to purchase airline tickets. But any unused ticket, if you let us know and let the airline know in advance, a lot of times you can maneuver that ticket. There will be a fee associated with that, but you can maneuver that ticket as well. Now the costs are broken down at a couple different deadlines, if you will. So the first deadline is 4 to 6 months in advance of the time that you take off. And during that time, somewhere in the neighborhood of about $2,000 is due. And that's going to cover not only a deposit, but it'll also cover usually and completely your airfare, although, again, subject to have to be a little bit more than that based on the cost of airfare. The other deadline is 2 months prior to the actual trip, and that's generally where we ask you to send in around $1,000 plus or minus, regardless, or in terms of how much is left from this $2,000 initial. And so if there's any overage that we need you to pay, that's the time that we pay that. Now, during this time, this is the time that you'll actually begin to send in some of your well, actually all of your documentation. Very important to be able to send in this documentation that goes along with it. So let's move to passports and visas. So we've got a visa application. All these forms, by the way, can be found on our website under the Forms tab on our website. If you just click on, you click on Trips and then Forms. And then it'll click on Forms and it'll ask for a password. The password's simple. It's one of our core values, disciples. And it's plural, by the way. There's an S on the end. So make sure you put that in there as well. And all of our mission trips, documentation and forms that you need to fill out will be under those forms. So we talked about deadlines. Now you've got your visa application with 2 passport photos. So you have that one visa application. So you'll put all your information there. And then what we need not just one, but we actually need 2 passport photos. These are the exact same type of photos that you went to, say, a Walgreens or a CVS or a drugstore to get your passport photos, or maybe even the post office to get that done. So you need to have 2 extra ones for your visa application. In addition to that, we ask you to send in your passport. Now, it's very important when you send in your passport that you send in a current passport, number one. Now, what is current? If it is 6 months within the expiration date, meaning that the expiration date is 6 months from now. So let's say this month is August. 6 months from now will be around January. If you fall somewhere in that range of 6 months, then you need to get your passport renewed. Even if you're going to make the trip within that time frame, you still have to have your passport renewed. A lot of times immigration, they want to have that with a wider range when you get on. So we try not to play with fires that relates to our passports. So if it's not expiring within 6 months, then you're okay to just send it in as is. If it is expiring, then you need to go ahead and renew. And by the way, the easiest place to deal with your passport is the United States Postal Service, or just go online. Just Google it, type in your passport, and you'll be able to find out all sorts of information as it relates to your passport, either renewal or getting it for the very first time. Some of the other forms that we require are medical release form, and we ask for every one of these forms to be notarized. You've got to take it to a notary public, and a lot of times your bank has a notary, drugstores a lot of times have notaries, county officials have notaries, a lot of different folks that actually are certified to do notary work, and so it must be notarized and turned in 2 months, again 2 months prior to, and then a permission slip if there are any minors on the trip. And then, of course, if you're a non-American citizen, then you're going to have to provide proof of status here in the country to be able to do that. Again, all of our forms, and it's in your follow-along guide there, all of our forms can be found on the website at helpwestafrica.org / keep forgetting to do the pin, / the number sign, / trips, / forms. Or you can just click on the tab that says trips and then the tab that says forms, and you'll be able to get there as well. So all of our forms are there, and don't forget the password on that is disciples, so you can get through for the forms. Very, very important. Put that in your follow-along guide as well. The password is disciple. Average time to new passport for a brand new passport, they're telling us, is about 4 to 6 weeks. And for a renewal, most people say it's less, but we still like to stick to that 4 to 6 week number. Just again, so we don't play with fire as it relates to getting your passport in time, so that you can get on the plane and be a part of the team that's going to go over to Nigeria. All right, so let's talk about medical issues, insurance, diseases, all of those sorts of things. Again, your medical release, it's part of the forms. It's got to be notarized. Your permission slip has to be filled out by a parent or a guardian if you're a minor. A lot of people ask about this. It's missionary travel insurance. We use a company called 7 Corners. 7 Corners, again, just Google that name and you'll find 7 Corners Insurance. They do a lot of missionary insurance, and they have specialized products just for short-term trips. And we use one of their products. Everybody has insurance when they go on these trips with us, and that's medical evacuation. It's emergency medical coverage. It is not primary care coverage as you would get here in the U.S., let's say. It's emergency medical coverage as it relates to just your short-term time there, and it's just covering you while you're on your trip. What about diseases, shots, medicines, all those things we don't like to talk about, we kind of have to. For a complete list, go to your mission trip information form. Very important form. It's under the Forms tab on the website, mission trip information form, and you'll find a complete list of potential diseases there on the form. Couple things to note. First, yellow fever used to be required, and as of this recording, August of 2014, yellow fever is no longer required right now, but highly, highly recommended. We as HELP recommend that very, very highly for you to be able to get your yellow fever. Also, one of the big things that is certainly required, that is malaria prophylaxis or prevention. There are three common treatments for that. One is a product called doxycycline. A second, which I use personally, is called Malarone. And then a third is another product called Mefloquine. I'm not quite sure. I think it's that right there, Mefloquine. And so these are all prescription products. So you've got to get a prescription from your physician. They've got to check you out before they'll write a prescription for this. But these are also mandatory because malaria is still very much prevalent in the area that we work in. So make sure that you're taking that prophylactically or preventively. It's very, very important. And then for other recommended immunizations, we recommend you talking with your travel health counselor at your local county or community health clinics. Very, very important to be able to talk to these healthcare professionals, especially those who have global health experience and as a background. By the way, as of this recording, again, August of 2011, the Ebola virus is kind of making a return in West Africa. Right now, it's in far West Africa, and there's only been one documented case in Nigeria, and it was from, I think it's one, maybe two, but it was from somebody traveling from either Liberia or Guinea, and they were coming in. So no documented cases as it relates to indigenous Ebola in Nigeria as of yet. And so again, just talk to your travel health professional, and they'll be able to give you some insight on that. So that's the diseases. Let's move on in your follow-along guide to accommodations. And let's talk a little bit about housing. Very important part of what we do. And what I'd like to do is actually take you on a little tour of where you'll be staying. So this is an overhead or an aerial look at kind of the upper two-thirds of Africa. And you can see Nigeria right here on the left-hand side. And so that's where you'll be. Let me take you on a little satellite tour of Nigeria as well. Let me first show you where we fly into. We fly into the capital city of Abuja, as we mentioned, ABV. Lagos is over here, LOS. I mentioned those two airport codes a little bit earlier in our training module. So we fly into Abuja, and then we take this federal highway right here, all the way down through the capital city of Kogi State. This is Kogi right here, where my mouse cursor is going. And then we take the federal highway across the famous Niger River, through Kaba, up through Mopa, and finally down into Egbe. This is where we work. This is where you'll be. So I'll take you on a satellite imagery of Egbe. You can see a big federal dam right there. And as we zoom in, I'll take you on a quick tour of the area and then finally where you'll stay. We talk a lot about our hospital partners. The hospital, the Ekwa Egbe Hospital, is right here, currently undergoing an incredible revitalization. The center of town, as you can probably tell, is right here, and a lot of commerce and trade going on in there. In this general area, it's thought to be about 70,000 people, just to give you kind of an idea in the Egbe surrounding area. So, where will you be staying? Actually, right here off of Waterworks Road, I'll show you the house that you will be staying in, and these will be your accommodations. It's got a corrugated tin roof on the top, and this right here is the house that you'll be staying in. Kind of a little bit grainy, but nonetheless you get the point. So in terms of housing, you'll be a part of the HELP guest house. In the guest house, you will be provided, of course, with food and accommodation. Electricity is not guaranteed, but we try our best with the accommodations that we have and with the setup that we have to be able to do that. Also, towels and sheets, all of those sorts of things are going to be provided for you when you get there. We do recommend just bring your own towel. We do have towels, but just bring, I'm just going to put your own towel just as a backup. A lot of people like to do that
and also some shower shoes and have those around. We do have showers. Obviously, we've got bunk beds that everybody's going to be sleeping in, and our housing is pretty good. In terms of personal belongings, very important. Just the same thing you would follow here at home in a public place, follow it there as well. Any of your personal belongings, especially if they're very valuable, just try to tuck those away somewhere. Put them where not a lot of people can gain access to them. Same thing you would do at home, no different here as well. And then communications. What about things such as cell phones, your iPhones, or your tablets, or your computers, or whatever they might be that you bring? Couple things as it relates to telecommunications when you're over there. In terms of cell phones, cell phone coverage can be spotty at times. Our guest house does have a team phone on site that you will have access to in minutes to. Our goal is that you can tell your loved ones that you try to call every couple of days. And the reason we tell them that is because there is a chance that the actual cell service may be going bad. And then in terms of computers, you are welcome to bring your laptop. Sometimes there is a Wi-Fi stick there, but don't count on it. So just be aware of that. We try to do the best we can in terms of at least getting you to be able to call home a few times while you're away. So just know that'll definitely be a part of what's going on. And then I mentioned electricity as well and what to expect there. Now, what about emergency contacts? Well, in Nigeria, things work a little bit different. It's kind of hard to get in touch with people because there's a lot of varying phone numbers for different people. In fact, most people have 2 or 3 phones, and you're not really sure, depending on the time of day and what day of the week, which phone they're actually using. So what we like to do is your trip leader will have access to phones along with help local staff. So the best way for anyone from America to get an emergency contact with somebody in Nigeria is to simply email the contacts that you see on the list there. So that's your international administrative assistant. That's also your local administrator, Mrs. Sunday. And then the international administrator, and that is myself. That's Scott Beebe. So you've got our details there, and of course your trip leaders will have those details as well. So if anybody needs to get in touch with you, or you need to get in touch with anybody and you need to route it through us, we are happy to make those contacts for you. And you see our emails there associated with your listening guide. Finally, let's go ahead and wrap this up. What to wear, what to pack, how to pack. We're going to have a module specifically on that. So questions around things like suitcases that you take on board and what fits and what do you take and all that. We're actually going to have a how to pack module. And then we're also going to have a kind of a what not to do and what to do general policies. It's called our policy awareness module. It'll likely be the last one that you watch before we're done. So that's the missionary trip information. Pretty harmless. I hope it wasn't terribly long for you and hope it was quite informative. By the way, feel free to ask your trip leader any of these questions. Again, thanks for joining us in Module 2 of Mission Trip Information. We'll see you on the next module.